Nurse Aide Written Exam Bcba. Question 1. The nurse aide is assisting a resident with a shower. The water temperature should be checked. Option A. Only at the beginning of the shower. Option B. By the resident. Option C. Before the resident enters and continuously during the shower. Option D. Only if the resident requests it. The correct answer is option C. Before the resident enters and continuously during the shower. Question 2. The nurse aide overhears two staff members discussing a resident's condition in the hallway. The nurse aide should: Option A. Join the conversation. Option B. Remind them this violates confidentiality and report if needed. Option C. Ignore the situation. Option D. Tell the resident about the conversation. The correct answer is option B. Remind them this violates confidentiality and report if needed. Question 3. When documenting care, the nurse aide should: Option A. Document care before providing it. Option B. Document care immediately after providing it. Option C. Wait until the end of the shift to document. Option D. Have another aide document the care provided. The correct answer is option B. Document care immediately after providing it. Question 4. Which of the following is a sign of resident neglect? Option A. A call light within reach. Option B. Clean, pressed clothing. Option C. Soiled bedding unchanged for hours. Option D. Timely response to requests. The correct answer is option C. Soiled bedding unchanged for hours. Question 5. A resident falls and hits their head. The nurse aide should: Option A. Apply a bandage and continue activities. Option B. Keep the resident still, call for the nurse, and monitor until help arrives. Option C. Help the resident to stand immediately. Option D. Give the resident pain medication. The correct answer is option B. Keep the resident still, call for the nurse, and monitor until help arrives. Question 6. A resident with Alzheimer's disease repeatedly asks, "Where is my mother?" The best response is: Option A. Your mother died years ago. Don't you remember? Option B. Tell me about your mother. What was she like? Option C. Ignore the question each time. Option D. You're in a nursing home now. Your mother isn't here. The correct answer is option B. Tell me about your mother. What was she like? Question 7. A resident's care plan is updated. Option A. Only on admission. Option B. Annually. Option C. When the resident's condition changes and at regular intervals. Option D. Only by the physician. The correct answer is option C. When the resident's condition changes and at regular intervals. Question 8. When applying a restraint to a resident, the nurse aide must: Option A. Apply it as tightly as possible. Option B. Tie it to the side rail. Option C. Check the resident at least every 2 hours. Option D. Obtain a physician's order first. The correct answer is option D. Obtain a physician's order first. Question 9. The nurse aide is assigned to care for a resident from a different cultural background. The best approach is: Option A. Provide care exactly as you would for any resident. Option B. Ask the resident or family about their cultural preferences. Option C. Assume you know what the resident needs. Option D. Avoid the resident. The correct answer is option B. Ask the resident or family about their cultural preferences. Question 10. A resident is admitted who speaks limited English. To communicate effectively, the nurse aide should: Option A. Speak loudly. Option B. Use pictures, gestures, and simple words. Option C. Avoid all communication attempts. Option D. Have a family member translate only for medical discussions. The correct answer is option B. Use pictures, gestures, and simple words. Question 11. A resident is on a clear liquid diet. Which item is allowed? Option A. Milk. Option B. Chicken broth. Option C. Cream soup. Option D. Ice cream. The correct answer is option B. Chicken broth. Question 12. A nurse aide who observes a coworker stealing a resident's personal items should: Option A. Confront the coworker directly. Option B. Ignore the situation. Option C. Report the observation to the supervisor immediately. Option D. Tell other coworkers but not the supervisor. The correct answer is option C. Report the observation to the supervisor immediately. Question 13. When providing catheter care, the nurse aide should cleanse: Option A. From the drainage bag toward the body. Option B, away from the body toward the drainage tube. Option C, in a circular motion around the abdomen. Option D, only with alcohol-based products. The correct answer is option B, away from the body toward the drainage tube. Question 14. A resident has a stage 2 pressure ulcer on the heel. The nurse aide should: Option A, massage the area to increase circulation. Option B, keep pressure off the heel using a heel protector or flotation device. Option C, apply ice to the heel. Option D, soak the heel in warm water. The correct answer is option B, keep pressure off the heel using a heel protector or flotation device. Question 15. Which approach is best when caring for a resident with dementia? Option A, vary the daily routine frequently. Option B, maintain a consistent routine and familiar environment. Option C, avoid talking to the resident to prevent confusion. Option D, provide complex tasks to challenge the resident. The correct answer is option B, maintain a consistent routine and familiar environment. Question 16. The nurse aide finds a resident lying on the floor. What should the nurse aide do first? Option A, help the resident up immediately. Option B, check the resident for injuries and call for the nurse. Option C, leave the resident to get a wheelchair. Option D, scold the resident for getting up alone. The correct answer is option B, check the resident for injuries and call for the nurse. Question 17. The nurse aide is taking a resident's blood pressure. The systolic pressure is the: Option A, second sound heard. Option B, first clear sound heard. Option C, pressure when the cuff is completely deflated. Option D, average of 2 readings. The correct answer is option B, first clear sound heard. Question 18. Contractures, muscle shortening, can be prevented by: Option A, keeping the resident in bed. Option B, performing range of motion exercises as ordered. Option C, avoiding movement of affected limbs. Option D, positioning the resident only on their back. The correct answer is option B, performing range of motion exercises as ordered. Question 19. The nurse aide finds a resident's bed in the high position with a side rail down. The nurse aide should: Option A, leave it as is. Option B, return the bed to the lowest position and check side rails per care plan. Option C, only raise the side rail. Option D, tell the resident to be careful. The correct answer is option B, return the bed to the lowest position and check side rails per care plan. Question 20. A resident is on transmission-based isolation precautions. When entering the room, the nurse aide should first: Option A, put on all required personal protective equipment, PPE. Option B, knock on the door and enter without PPE. Option C, ask the resident what equipment is needed. Option D, remove existing PPE from the previous caregiver. The correct answer is option A, put on all required personal protective equipment, PPE.